Welcome everyone, good morning. Dear audience, let's think about a minute how important and relevant could be if a patient has Clostridium difficile infection or not. Depending on the answer, he or she has a bigger or a lower chance of recovery. So our topic, therapeutic strategies in Clostridium difficile infection. This name of this kind of infection, the new name of it, may be the better known and previous name, that's Clostridium difficile. So let me introduce myself. I'm Dániel Bednárik. I'm a PhD student and a resident doctor in Heim Children's Hospital. My supervisors are Katalin Lenti and László Földvári Nagy. My SMS, Anne Trans. My vision. Every patient should have the chance to get the best possible therapies in healthcare against Clostridium difficile infection. And my mission for it, find the best possible therapies in healthcare against Clostridium difficile infection. These are my projects. I started the first project in this year, September, and we started the second one in this year, November. So let me introduce to you my first project. The title of it, Comparing the Effectiveness and Safety of Different Therapies in Clostridium difficile infection in Adults. A little bit about the background. Why is this a hot topic nowadays, and why is this a really relevant and a really important topic? So this is the most common healthcare associated diarrhea worldwide. From 20 to 27% of this kind of diarrhea caused by C. diff infection. According to the latest data, almost 500,000 cases were recorded in the US among adults and children. And which is really important again, more than 10,000 deaths in the US were recorded according to the latest data. The incidence of relapses is around from 15 to 35%. In practice, we call relapse when we found, again, any symptoms of C. diff infection within 8 weeks. So our aim is to find the best possible therapy. Our clinical question, which is the best therapeutic option for Clostridium difficile infection? For this, we use the PICO framework, P, adult patients with C. diff infection, I and C, any intervention given, for example, antibiotics, fecal microbiota transplant, or antibody therapy. Primary outcome, the clinical resolution of C. diff-associated diarrhea, recurrency, overall survival. Secondary outcome, morbidity and side effects. Or hypothesis, fecal microbiota transplant is the superior therapy for C. diff infection. Or clinical and research implication, quicker recovery, fever relapses, and prevention of potentially serious consequences, for example, mortality. We did our systematic search during November, the middle of November, and with this final search key in the three big databases. We found a little bit more than 6,500 articles, and after the duplicate removal, we've got a little bit more than 4,300 articles. We've done the abstract and title selection with the Cohen's kappa 0.91, and now we've got 542 articles, and nowadays we are doing the full text selection. We would like to finish with it till the end of this year. Now let me introduce to you my second project. The title of this, Comparing the Effectiveness and Safety of Different Therapies in Clostridium difficile infection in Pediatric Patients. A little bit about the background. It's more or less the same like in the adult population, but let me highlight a few really important things to you. So there were, according to the latest data, around 8,000 hospitalized children who had C. diff infection in the US. And this is the reason why is it so important and why is it a hot topic nowadays. So the number of cases are growing among children too. And let me highlight one more thing. So in this population, in the pediatric population, this infection is absolutely relevant on those children who spend a lot of time in hospital. Because of their underlying disease, it's really important to give them the best possible and the most effective therapy against Clostridium difficile infection. So our aim is to find the best possible therapy in children. Our clinical question, which is the best therapeutic option for C. diff infection? For this, we use the PICO framework, P children under age 18 with C. diff infection, I and C, fecal microbiota transplant, or any other intervention given, for example, antibiotics, antibody. For outcome, the clinical resolution of C. diff associated diarrhea, recurrency over survival, morbidity, and side effects. Or hypothesis, fecal microbiota transplant is the superior therapy for C. diff infection in children. And our clinical and research implication, quicker recovery, fewer relapses, and prevention of potential serious consequences. We did our preliminary search with this search key, and during the preliminary search, we found around 7,000 articles in the 3 big databases. So these are our key articles we've chosen during the preliminary search. In the first and in the second one, both are RCTs, by the way, and in these 2 studies, they compare different kinds of antibiotics, how effective and how safe they are against C. diff infection. The third one, it's a trial about how effective and how safe the fecal microbiota transplant among children, and which is really important for us. All the key articles gave us the Q rate as a result. During our preliminary research, we didn't find any Prospero registration and any previous systematic review and meta-analysis, but hopefully we will finish our Prospero registration soon. So for summary, we would like to finish our 2 projects till the next summer, so the summer of 2023. And at the end, let me finish my presentation with a sentence from Abbas and Georgi. He had a lot of sentences, but now I've chosen this one. Whatever a man does, he must do first in his mind. So thank you for your kindly attention.
So thank you for your presentation. My question is to your second project. So is it common to use fecal microbiota transplant in Hungary among children patients?
Really, really good question. Thank you so much. So this is one of the reasons it's a so hot topic in Hungary too. So nowadays in Hungary we started this therapy among children too. Nowadays only one center, the center of Debrecen, started this among children too. So it's not everyday thing, but we try it, so we will see how effective and how therapeutic in Hungary to this method.
Thank you for your presentation. Very interesting topic. I was wondering if there is any strategy that you can do to prevent this susceptibility to the Clostridioid difficile infection for the children, to increase the good bacteria in the microbiota with food, or if the mother can do something beforehand, if there is any strategy, so we do not need antibiotics or fecal transplant.
It's again a really, really good question. Thank you so much. So yeah, there are a few strategies for prevention. So if we have got enough data for it, we would like to involve these strategies too. So maybe if it's possible, we would like to do a subgroup analysis for the possible prevention ways.
Do you plan to differ the CD disease based on the severity of this disease?
It's a really good question again, thank you. So we will see how many data we have got, how we will have. So according to this, maybe we will do, so maybe we can do a subgroup for the fulminant and non-fulminant one, and in the fulminant maybe for the primary and the secondary and the recurrence cases too. So if we have got enough data, we would like to do absolutely subgroup analysis to that.
There is another aspect actually of this last question. Since, as you said, I mean, many of your patients have actually a major disease,
Yeah.
I mean, comorbidity. So therefore, when you do your studies, I mean, you have to deal with this as the basic disease itself, I mean, have actually morbidities and
Yeah.
mortalities.
Mm-hmm.
So therefore, you just cannot put everything together, but you have to actually look at the increments or whatever, I mean, something that...
Yeah,
Have you
absolutely,
planned-
you're right, we will see. So in the case of adult population, because thankfully the mortality and the morbidity that's rather important in the population of adults, so thankfully in the population of children the morbidity is really low, thankfully. But in the case of adults, there were more previous meta-analyses. One meta-analysis from 2017, and they checked only the primary cases of C. diff infections, and there were another previous meta-analysis where they investigated the recurrent one. So we saw in the literature it's possible. It's absolutely a challenge for us, we know, but we hope we can do it. So yeah, we'll see.